So BHRT, which is bioidentical hormone replacement, is where we understand that patients' hormone levels may be, quote, normal, but may not be as normal as it used to be when they were younger. I, as a plastic surgeon, usually see patients that come in asking for an improvement in their appearance, whether it's face or whether it's their body. However, something that is inside that is kind of reflected in their outside appearance, sometimes there's a mismatch and an imbalance. And that is why the wellness program that we have instituted, I think, really kind of completes the treatment of a patient as a whole. What we know now is that there is a huge difference between the hormone level when you were young. I'm talking about in the teens or early 20s versus when you're older, like you're in your 50s or 60s or 70s. And I think one of the things that happens as we get older is that as these hormone level drops, and although they may be within the normal parameter, perhaps you're feeling that difference of that hormone level of when you were young compared to as you got older. And I think it's important to actually try to push that level kind of back up to how it used to be when you were younger. And that is an important component of bioidentical hormone replacement. So when we talk about it being bioidentical hormone, what we're talking about is these hormones are exactly the same, down to every amino acid sequence as our physiological hormones. They can be either synthetically made, meaning it's made in the lab, or they can be procured from whether it's plants or animals. The 4 key hormones that we are targeting are testosterone, and for women, estrogen and progesterone. And then there's another hormone that we sometimes forget about, which is thyroid hormones. Because all these hormones have so many interactions with our body and tissue, everybody actually feels a little bit different. Common themes always seems to be things like lack of sleep. The other is lack of energy. They don't have as much energy as they used to be. Cognitive function. Especially high performers, that really is a quite disturbing thing in their life. Lack of perhaps an intimacy or the feeling of intimacy. So all in all, these 4 hormones are integral part of all of these factors. And we may think, oh, testosterone is only a male hormone, but it's not. Her concentration, even for women, their testosterone level is actually higher than their estrogen level. So it's a critical hormone that exists in all humans. I think what's a staple point for all bioidentical hormone replacement is replacing testosterone. Testosterone is such an integral part of the function of people, whether it's at the level of their heart, whether it's the level of their brain, whether it's the level of their skeletal muscles. It plays a role in all aspects of our tissue function. We know for sure that by the time that you have reached, let's say, your mid-20s, the level of testosterone drops precipitously. And for some people, much more drastic than others. So in all patients who feel like they're not quite themselves, that they feel more fatigued and have cognitive dysfunction, as well as kind of that lack of energy, then I think testosterone replacement is one of the first line of therapy. One of the things that we always do, of course, is we do get laboratory results and take a look at their entire profile, not just testosterone levels, because all hormones are a little bit related with one another. But if the testosterone level is more on the lower side, then they are good candidates for testosterone replacement. But not all testosterone replacement is the same. There are different forms of testosterone that you can take, whether it's oral, whether it's topical cream, whether it's injection, or whether it's pellets. In our clinic, we feel like the pellet is really the way to go. So what pellets are very slow-releasing capsule that is inserted underneath the skin usually at the gluteal area of our body. And it really is literally a 5-minute procedure that we do under local anesthesia. And what they provide is consistent, even level of testosterone level in our system for 3 to 4 months. So overall, it's got that comprehensive vitality. It's overall global general well-being. And testosterone certainly sits at the bedrock level of these improvements. And that's true whether it's male or females. Thyroid hormone is also quite important because it really sets the metabolic rate as well as metabolic regulation of our body. Our normal body, as we age, we know that the thyroid level does go down. And as a consequence, our metabolism also goes down. So if the thyroid level that we get from a laboratory test kind of like indicates that it's in the normal range of norm, then we do want to kind of push it to that more youthful state. In our clinic, we do like the natural desiccated replacement of thyroid, which is a combination of both T4 and T3, because that's the physiological kind of balance between the two types of thyroid hormones. And they do different things. I mean, T4 is just an inactive precursor for an active form of thyroid hormone, which is T3. The next thing that we look at then, certainly for women, especially if they're postmenopausal, is we look at their estrogen levels, especially if they have the hallmark symptoms of low estrogen problems, such as hot flashes or their memory is slightly impaired. Some people, they have intolerance to cold, or some people have arthritic or bony changes. And these patients are really perfect for estrogen replacement. As we know now, the controversy of estrogen replacement is in the backseat now, because we do know now that estrogen replacement does not increase any oncological risks. And therefore, in our clinic, for postmenopausal women who seem to have postmenopausal type of symptoms, then we do replace the estrogen along with the testosterone. And in a similar fashion, estrogen can be replaced as a pellet that can last anywhere from 3 to 4 months. And so we usually offer this as a combination. So testosterone and estrogen together. So this is the entire sort of bioidentical hormone replacement menu that we currently take a look at. There are obviously other hormones as well, but we find that these 4 hormones are critical to the overall well-being of anybody, especially as we get older.